A project in Cape Town's sprawling township of Khayelitsha hopes to help arrest mental health issues that affect millions of South African children. Only 1 in 10 children with a treatable mental health disorder can access required care. Now, as a result, their mental health challenges extend into adulthood, which while their development lags behind. Now, the Cape Town project, possibly the only one in the world dedicated to child and adolescent mental health, has seen demand rise 4.2% with an admission rate of 18% in some local hospitals. Joining us now for insight into the project and its services is advanced clinical psychiatric nurse specialist and founder of the project, Dr. Stella Mokitimi. Dr. Mokitimi, good evening and thank you very much for your time. The unintended consequence of our failing healthcare services, particularly when it comes to mental conditions, has really hampered the care that needs to be given to children and adolescents as well. Just expand a little bit the extent of the problem, especially for that cohort.
Thank you so much for the question and good evening, and thank you for having me tonight. Yes, you know, it is a big challenge in many areas and in many environments. There is lack of infrastructure for children and adolescents with mental health problems. For an example, at the primary level of care, where it is actually the first entry, you know, for intervention for children and adolescents, there you will find children and adolescents queuing and being seen in the services together with adults who have got psychotic disorders, who sometimes are behaving inappropriately because of their psychosis. And then you go to the secondary level in district hospitals where they have to be admitted for emergency care for 72-hour observation. Again, there is lack of infrastructure because those children are admitted with adults who are again psychotic and pose danger to them, and that is re-traumatizing them. So, yes, it is a huge problem.
Now, you have, of course, started this program, and so far you have identified some hospitals and some care areas, particularly 9 clinics where you have started this program. How do you tackle the challenge of creating spaces that are low-risk areas where they will not be in contact with adult psychiatric patients?
That project started with engagement with the key stakeholders, being the service providers at grassroots level. Those are the mental health nurses who are providing the service, as well as the facility managers in those facilities that are providing the service. So we needed to engage and also look at the current evidence of the problem within our local context, where we conducted a study and it generated evidence to say these children are re-traumatized. We cannot continue to provide a service like this. And therefore, we needed to incorporate their recommendations as well into this planning for the project. So that's how it started. So the engagement occurred with these stakeholders in all the 9 clinics within the Khayelitsha Eastern substructure in Cape Town. So we had to redesign the service in each facility, but also make sure that the redesign again speaks to the context of that particular facility, where you will find now mental health services restructured in each facility such that each facility provides at least a day away from the adults, and that day is dedicated for child and adolescent mental health services. When they come on that day, they are not seen with adults. There are no adult psychotic or psychiatric patients. It's only the nurse and the parents who are bringing the child with a mental health problem and the child. So other facilities, it could be either on a Monday or on a Tuesday. Again, as I'm saying, it has to speak to the context of that facility.
Right.
In other facilities, you'll find those services either being provided in the morning so that the children are receiving the service in the morning and they can quickly go to school.
Yeah.
In other facilities, they opted for an afternoon, for an example, so that they go to school and after school they come. As the caseload builds for each clinic, then they start increasing the time and provide the service for the whole day. As we are speaking, all our 9 clinics are providing separate child and adolescent mental health services at primary level of care.
Right.
So when we come to the district hospitals, we've got 3 district hospitals. Again, we needed to structure the service at district hospital based on the context and the needs of that particular hospital. And you will find a variation there. One of the hospitals was able to provide 1 room, at least just for got mental health problems. And the other facilities, they did not have the infrastructure at all. But at least what they could do was to make sure that they accommodate the adolescents, again, from 13 to 18, in a space where they are more contained, less dangerous, highly vulnerable adult patients
Right.
who will not pose danger to the adolescent.
So it's not just the dedicated clinic days or the separate rooms that you're providing. Of course, it goes a little bit further than that. What has been your observation on the degree and the level of training of the staff to deal with young psychiatric patients? And what have you put in place and what are you recommending going forward?
Oh, definitely. We could not start with this project without considering increasing capacity of our service providers. That was the first thing. So we looked at the training, and we are providing training continuously for the nurses who are providing the service. We started linking up with the tertiary child and adolescent specialist units who are specializing in child and adolescent mental health services and have been running these services with highly experienced staff. So we linked those nurses who are coming from the clinics with the staff and the experts at tertiary level. So they provide those training on a monthly basis on Fridays for the staff.
And going forward, I mean, what would you say is the biggest lesson that you have taken from the couple of projects that have been put in place? I mean, you already mentioned, for example, you were confronted with lack of infrastructure in some projects. But I suppose your bigger goal is to have these dedicated spaces available 24/7 throughout the year. But what lessons are you picking up from what you've put in place so far?
Great lessons should be learned by other areas as well from this. You know, I think most environments, especially in our low and middle income countries, the biggest problem is the lack of resources, the lack of infrastructure because of lack of financing. And we always say we do not have money. We don't have money to build, these facilities. But the biggest lesson is that we are able to provide, to do the innovations, to provide still a service that is satisfactory, a service that is responsive to the needs of the children and adolescents with the little resources that we have. Sometimes we don't have to wait for 5 years to build a clinic, to build a hospital. You can use the space. Let me make a practical example. A nurse in a clinic who has got only 1 room to provide the service. What we say to that nurse, okay, let us create this structure. How are we going to provide these resources for children and adolescents? Once you have that special day for them, we have to provide the appropriate assessment tools. All we need in that room is just a special corner, within this room. Let's claim a piece of this room where we can put a small table, and small chairs, and put an assessment toy box there. Let us make our walls and put posters and everything to make the room, child-friendly for that day. That's all we need. while we are waiting. So the biggest lesson is, of course, that we should be open to innovations. There is a lot that we can do with the little resources that we have.
Now, of course, I've already mentioned that the services have seen an increase in terms of the uptake, in terms of the people who have come to the clinics, rising 4.2%. Is there, where it's a fairly new service at this point, of you being able to really get feedback as to what the impact is currently of these child-friendly services on the health of the patients themselves?
We have not yet formally engaged with the users in terms of exploring their own perspective of the service as yet. There will come a stage when we're definitely going to do that. But because our stats is already showing us that there is a rise, in the number of cases that are seen within these spaces, it shows that now, because before, there was lack of attendance, lack of utilization of the service. Now, when we see a rise, definitely there is something that is attracting them to the service, that is making them utilize the service even more. So at least from that little information, it tells us that there is something better that is being done.
Dr. Mokitimi, I appreciate your time, and thank you very much for coming on and sharing this fantastic program with us tonight. She is Dr. Stella Mokitimi, Clinical Program Coordinator for Mental Health at the Khayelitsha Eastern Substructure.